Hi, I'm Laura Flanders. Not so long ago on the show, I got a chance to interview two people who had co-edited a book about moving beyond justice. It's all about transformative justice techniques. How do you actually look after your loved ones, your peer group, your pod, as they called it, without calling the police or without necessarily reaching for that 911 number first? In the context of the COVID-19 epidemic, that question is becoming more relevant than ever, as people who are not treated well by our social services or by our security services as the state are finding themselves in need, nonetheless, of help. The homeless population of New York saw its first death to COVID-19 just a few days ago, and the numbers will surely mount. I've brought onto the phone Allilsa Fernandez, who is a peer specialist working with people with mental disabilities at Lenox Hill Hospital. She's also working with the Sylvia Rivera Law Project, which deals a lot with homeless people in need and LGBTQIA homeless people. And she is, in addition, one of the board members of NCIL, the National Centers for Inclusive Living organization that we profiled on a show not so long ago. So, Allilsa, thanks so much for joining me. You do so many things, I don't quite know where to start. But let's start with introducing ourselves for our audience that may be relying more on listening than viewing. I'm a white woman in her 50s with kind of blondish hair and a black shirt, sitting in an odd little unheated cabin in upstate New York. How about you?
I am a color person, non-binary. I have dark short hair. My shirt is red with black lines, and I am in my room right now currently.
So what are you seeing? I'm so happy to be talking to you. I feel happy, but the news is so grim. And when I saw that first officially reported fatality of the homeless person in New York, I thought, wow, that must just be the tip of an iceberg. What are you seeing out there?
Yeah, I just knew that was going to happen. So I've been doing some work with the Sylvia Rivera Law Project on shelter organizing. And that was one of the concerns that I brought to the table. What are we going to do for the homeless population in preparation for COVID? This was at the beginning stages when the government and the leadership were saying it's still not even in New York yet. So we started to plan, like, what are we going to do? What's that going to look like? Are there any policies in place from the DHS, the Department of Homelessness? And to be honest, there wasn't much in place. So I sent out a letter along with other members of the shelter organizing to the DHS and to other leadership. And sadly, there wasn't much in place. So all this to say, I knew this was coming. When the first death of the homelessness of a homeless person happened, I said, wow, this is exactly what I have feared. And
so what we've been talking about in this conversation about transformative justice is what to do when the state either doesn't or won't, or you don't want it to be involved and addressing your challenges. What do you do? What are homeless people doing? People that are unhomed?
So unfortunately, unlike other states, for example, Seattle, they started to host people in hotels and in other environments so that they can quarantine. At least that I am aware of. Perhaps it's happening, but I'm not aware of that research. I don't know that that's happening in New York City. And with the majority of the homeless population that I am currently working with, that's not taking place. So sadly, people are quarantined within the shelters. So right now, for example, I know of a homeless lady living in a domestic violence shelter who tested positive, and she's still within the shelter, right? And still has to get food. There's not really like a good system in place. So it's only a matter of time before other people get it as well within the system. And then we're seeing in the case of that homeless person who went to the hospital and he told them that he had nowhere to quarantine, that he was living in a shelter where it's more of an open space. And the hospital was like, you can't stay here. So you just have to go back. So even though he tested positive, he still had to go back to the shelter where more people are likely to get it.
What are the shelter staff saying about all of this?
A lot of them are working from home, from what I'm hearing from homeless people. Some of them is just working within the circumstances, trying to keep the 6 feet away, trying not to interact with clients. But then the bad thing is that what we've seen in the front lines is that the homeless people don't have food. So they will have to go through other people to go outside to the supermarket, possibly get exposed there as well to get the food. And remember, these people don't have proper protective gears. None of these homeless people. They don't have hand sanitizer like other people do. They don't have the privilege to Clorox, to cleaning supplies, to many of the things that many of us have.
Is there any possibility for mutual aid, for help, for care? What's working?
Unfortunately, when it comes to supplies, there's been a lot of hoarding. So we can't find things that they need. And even when we find things that they need, let's say like soap, if they're sleeping in the streets, it's impossible for them to wash their hands. It's impossible for them to have that continuous hygiene care. So I do know that some people, but in other states, unfortunately not in New York, they started providing hand sanitizers locally, where they're putting them in gas stations and in places where homeless people can access it. But we don't have that in New York. So it's a bit of a challenge in that area. As far as food, that's something that we have been working around the clock to get people food. And even that has its limitations. So for example, with domestic violence shelters, you can't disclose where you're living. So if I wanted to help out that community, I can't deliver. I can't send groceries to them, which is sad. So the best way to help these people is, again, to have them exposed, to meet people within a certain space to pick up the food. So it's still a challenge, but we're doing the work.
Now, when you say we, I'm curious to know a little bit more about who the we is,
yes,
and what your days are like, because you're dealing with your own challenges.
Yes,
you're an EMT worker.
Unfortunately, I fall within the high risk group, so I had to take off from working as an EMT, which is it makes me emotional, because I ask myself, am I doing enough? Should I be more directly in the front lines, or should I be doing what I'm doing, which is organizing from my home? So that's been a challenge for me. But with that being said, I work with connecting people to resources. So homeless pregnant mothers, homeless mothers who have children, homeless people in general. And I work hand in hand with this person whose name is Sasha. They work directly with Sylvia Rivera and also Sergio. They're actually delivering the food. They're actually gathering the food. Honestly, it just makes me tear up. These are phenomenal leaders who every single day are placing their own lives at risk to deliver this food to the community. So it's amazing what they're doing. Absolutely amazing.
We talked with Ijeris and Leah on the program about mapping your pod, like who are your people when you need them? And is there a process you can go through with those people so that they can effectively be there for one another in a time of need? Do you practice anything equivalent? Are emergency workers practicing anything equivalent in these times? Because the stress everybody's under, as you just mentioned, is tremendous. And people who give help are not always the first to get it or ask for it even.
I think right now we're just living in the times where we're seeing that there's many people who are offering support. I don't think we're organizing like we used to, where we were vetting people, like who should we count as a volunteer? I think these are times that trust is just there, and we just rely on each other as a community as a whole. So what we're seeing now that we're also using is mutual aid. Who needs to help? Who needs to support? And who's willing to give it? So even with like mental health, for example, I'm a part of an organization can't recall the exact name right now, but I volunteer my time to connect with frontline healthcare workers. And if they needed to talk or they needed to vent or they needed to process, I'll be there. And there's been a bunch of us healthcare workers who have signed up to volunteer. And then you have the people who need the help. And I think that that's how most mutual aids are operating right now. A list of who needs the help and who's offering the help.
Now, you've got a lot of experience dealing with people who have mental health challenges of different kinds and of coming up with ways to make life a little bit more manageable. That might make you the expert at this point, as so many people are feeling like life's pretty overwhelming. What do you think the mental health community and people with mental disabilities can bring to this moment that does benefit everybody?
Oh, that's a tough question. And here's why. Because depending where you sit and the privileges that you have is how you will view your world. So one of the things I've been noticing is that for people who are not in the front line, the way they perceive this horrific event, because it's truly horrific, it's a completely different way than frontline workers. I think acknowledging that there's a different perception to this trauma and how people process this trauma as well is going to be completely different.
So how is it distinct? How is the people locked up at home or shut up at home as they perceive it, and the people at the front line, how are they different at this moment?
It mainly revolves around this change of structure, the changes of work, right? What am I supposed to do now at home? And so most of the anxiety and panic is around that, or getting COVID or the symptoms of COVID. Frontline workers, their trauma is completely different. It's more of, am I going to get to live today? Am I going to go home and be able to see my kid? You have single mothers who don't even know where to send their child to keep that separation, to not give their child COVID that they may have gotten infected with. Or a lot of the healthcare workers, in particular in New York, they're not getting tested. So the anxiety is, oh my God, am I going to take this back to my patients? I don't know. And since they lack PPE, what does that mean? So it's a completely different stressor. They're also living in a wartime where they're doing a lot of rationing, and rationing means critical triage. And that's very stressful. I can't explain. And I was an EMT during the time of Ebola, and I can't begin to explain the stress that one feels when you have to choose. It's honestly, you have to choose who's going to get to live and who's going to get to life. That's very stressful. And it's not something that people do spontaneously. It's something that really takes a toll.
How many fatalities are people seeing at this point?
Right now, nurses and healthcare workers are reporting about 6 to 10 deaths per hour. It makes me tear up. And we're not hearing that in the media. We're not hearing that. In fact, a lot of hospitals has placed gag rules, which there's this organization called FIRE, who is beginning to speak about the rights about our healthcare workers, to speak about what's happening in the front lines, because it places them in danger and it places the patients in danger. And I have a feeling that the numbers being reported is less than what it actually is. And then you also have homeless people or vulnerable people who are dying at home, and they may not even be counted in those numbers because they never received the test. So I predict that the numbers are higher than what we're seeing in the media.
So 2 last questions. One, just to return briefly to the question of people without homes. London, the BBC recently reported, has 300 homeless people housed in hotels in the center of London, hotels that would otherwise be empty. It's keeping people employed. It's giving people homes. What's New York doing, as far as you know?
I have no idea. Right now, what I'm hearing from the front line, what I'm hearing from homeless people is that they have to stay in these shelters. And the people who are getting the care in the ERs are being sent back to these shelters. So it doesn't seem there's any regards there. There's no quarantine place that I know of. There's no measures. I saw a recent report that they're saying that it's a miscommunication. I don't know how much of that is true. I mean, this is what I'm hearing from directly the homeless community. It's completely different than what's being said in the media.
And then my last question has to do with the show that we're launching now around transformative justice, moving beyond survival. What does this moment bring to that conversation? And vice versa, what does this discussion about transformative justice have to do with this moment in your experience?
I think that we're starting to see, and that may be the silver lining, we're starting to see how communities is vital. It's just vital. Having communal spaces, being able to rely on each other and not depend on the individualism that's been created by capitalism, that's been created by the state. And I think a lot of communities have dealt with that because we have lived through traumas. People of color has lived through traumas for centuries. They've known, and we've known, that the government doesn't come for us. We've seen it with Hurricane Maria. We've seen it with Hurricane Harvey. The government's not going to come for colored people. So we've learned to rely on each other and to support each other. But I think now we're seeing it moving to other races and genders and so forth. And people are starting to see, wow, we need to really rely on each other. We really need to depend on each other. Even the richest hospitals are depending on each other's support to get through this.
It's ironic, though. I feel as if we had this discussion after the financial crisis, the mortgage crisis. People said, well, white middle class people are losing their homes now, but people of color, especially African American communities, were losing their homes for a decade already because of these balloon interest mortgages.
Yes.
Will it be different this time as we come out of this? Will we do more than recover? What will it take?
I think, honestly, the conversations are starting now. I think it really depends on the people who are in the front lines, the people who are leading the mutual aids and these supportive organizations. I think it's really going to depend on them keeping the momentum after the crisis and showing this is what we did with the crisis and what we need to continue doing long after, caring for the most vulnerable. For example, right now in New York State, which is I find absolutely ridiculous, to go back to wealth, people with homes, their mortgages were either they freezed it pretty much. Yeah. For suspended. 2 months or so. Yeah, they were suspended. Exactly. Thank you. They were suspended. But the people who needed the most, which are renters, because they're not getting paid, because they lost their jobs, because they're high risk group, so they needed to step back. Their rent is not frozen. Their rent is not suspended. So we really need to advocate and continue to advocate for the most vulnerable and take this opportunity to really change things and really start from there and not concentrate on the most powerful. I think right now we have a wonderful opportunity to redesign the system and really take into consideration the most vulnerable, but we really have to show up.
Allilsa, how did you come to this work?
My own experiences. I myself have battled with psychosis. That changed my life. Before that point in my life, I was living oblivious. I had a lot of privileges, but finding myself homeless lacking of work, and in the most vulnerable category, it just opened up my eyes. It's a complete different world, and even now, as I do the work, I think of myself and I'm like, wow, I'm privileged. How can I contribute? How can I continue to contribute? Because right now I have food, but I know of people who are eating their last meal today. I know of people who are worried of how they're going to get their meal today. I know of people who have been going to the schools, risking their lives to get kids their lunches because they don't have food. They lost their jobs. They don't qualify for food stamps yet, and they've lost their jobs because of the situation, and they don't have money. They were living paycheck to paycheck already. So, yeah.